Good afternoon, and thank you for joining us for our COVID-19 briefing. We usually start with County Executive Rich Fitzgerald, but he has a scheduling conflict today, so it's just me. And as I normally do, I will start with the numbers, which are headed in a favorable direction. After peaking at over 3,000 cases a day in early January, we are now averaging fewer than 450 new cases a day. And yesterday, we had our first sub 300 per day for the first time since early November. And today, we reported cases below 200. As we come out of the Omicron surge, the rate continues to slow, and our other indicators are also encouraging. Our positivity rate has fallen. It is now around 15%, which is a 20% decline or drop from the peak. Like cases, hospitalizations also continue to decline, which is great news for our dedicated healthcare providers who have had a very challenging few months. As for deaths, January was not good. So far, we are aware of 284 deaths in January, making it the third deadliest month of the pandemic, behind only December of 2020 and January of 2021. I hope and anticipate that February will have fewer deaths given our declining hospitalizations, but it's too early to know for sure what the February numbers will be as deaths lag other indicators. For the past nearly 2 years, I have reported cases and positivity rates to you as metrics of the risk of COVID in our county. However, let me explain why it is increasingly unreliable to use these two metrics to assess community risk. As you know, more and more people are using at-home rapid tests, which are not reported into the state surveillance system. For the health department, this means that we do not and will not have complete data on cases. Furthermore, limited data may be biased based on who uses community or laboratory testing versus at-home testing. Because of the ongoing changes in testing, as we look to the future of the pandemic, we at the health department will increasingly rely on different metrics to monitor community risk. We will focus on hospitalizations, reports of outbreaks, wastewater surveillance, syndromic surveillance of emergency room use, and also deaths. In recognition that case data are increasingly unreliable, we are reevaluating our public reporting process and anticipate that in the near future, we will stop providing daily case counts and focus on the weekly reports of hospitalizations and the other metrics I already mentioned. So in the near future, we will begin sharing with the public both vaccine and wastewater surveillance dashboards, and I'll provide more details about that at our next briefing. Right now, all of the indicators are headed in the right direction. That is, they're declining. We have seen a big drop off in COVID testing over the past few weeks. And I want to remind you why it remains important to get tested for COVID if you have symptoms or you're exposed. First, if you have COVID, we want you to follow isolation guidance to reduce spread. Second, the available treatments for COVID all require a positive COVID test, and the treatments are most effective when given early in the course of illness. So it's best to test early so that treatments can be offered when appropriate. Good news is that the repertoire of treatments to prevent severe COVID disease continue to increase. Just last week, the FDA gave emergency use authorization for a new monoclonal antibody treatment that is effective against the Omicron variant, and other treatments are being evaluated. Increasingly available treatments combined with effective and safe vaccines are essential for keeping people protected from the worst effects of COVID and allowing us all to get back to more social interactions safely. In terms of vaccines, on Friday, the FDA decided to delay for at least another 2 months approval of vaccines for the youngest members of our community, infants and children 6 months to 4 years of age. And so we wait. But as we wait, people in our community continue to get vaccinated. In the month of January, more than 20,000 county residents got their first dose of vaccine, which is progress, slow and steady, but still progress. The mountain of evidence for the safety and effectiveness of vaccines continues to grow. I was heartened to learn of a new CDC study announced yesterday that showed that infants whose mothers were fully vaccinated during pregnancy are significantly less likely to be hospitalized from COVID during their first 6 months of life. Previous studies demonstrated that pregnant women who get vaccinated and get COVID fare far better than the unvaccinated. That news, of course, leads me back to the message I deliver every briefing. Please get vaccinated. The vaccines are safe, they are proven, they help protect you, your loved ones, and the community from the most serious effects of COVID-19, including hospitalizations and deaths. They protect adults, children 5 and under, and pregnant women. They could be the difference between life and death, and I don't want to see anyone else die when they don't have to. So please talk to your trusted healthcare provider to get the facts. In closing, I take note of this gorgeous day, sunny and around 60 degrees. It's still February here in Western Pennsylvania, and yet we don't get many days like this, so please take advantage. These days remind us that spring is close, and with spring weather, we will all be able to spend longer periods outdoors. Spending time outdoors is good for your mental health and your physical health, especially if you can get some physical activity too. It can reduce stress, improve sleep, and strengthen your immune system. So, as the weather warms up, daylight hours increase, and the COVID cases hopefully continue to decrease, go outside, take a stroll, meet friends and neighbors, enjoy outdoor food offerings, and any other activity that brings you joy. So thank you for your time, and as always, be safe and be kind.
We only have one question that was submitted for today's briefing, and that is from Public Source. With the recent delay by the FDA in considering a vaccine for children under 5, what is the county's message to parents of young children who might be skeptical, about either the vaccine's safety or its value now that they've made it through recent surges?
You know, we all worry about infants and toddlers as parents and as members of the community, and we want to be sure that all the data are in and that all the safety data are in. And I really appreciate the FDA's caution in that matter. The vaccines they've approved to date have proven safe in all age groups that they've been approved for. And they need to do the same thing for the youngest infants. The vaccine, as you know, is going to be a 3-part series, and the FDA only had safety data on the first 2 of the series, not the 3rd. And so I appreciate their caution in waiting till all 3 doses are ready and have been evaluated. You know, the FDA has been criticized for being too fast, too slow, but their track record is really great. And I really appreciate the fact that they're following the science and being cautious on our youngest children. So again, when the vaccine is ready and they approve it, I will wholeheartedly look forward to seeing the data and support its use in our youngest children.
That is the final question. If you have any closing remarks.
I say people should get outside and enjoy the rest of this beautiful day, get a walk, get some sunshine, and thank you for joining us.
Thank you for joining us. Our next regularly scheduled briefing is Wednesday, March 2nd at 4 p.m.